New Mexico PBS Election 2012 coverage is presented in part by the American Cancer Society Cancer Action Network, through its Cancer Votes initiative, is educating the public and candidates about actions lawmakers can take to make fighting cancer a national priority. And by
Urenco USA, proud to support New Mexico PBS. Urenco operates the United States' first uranium enrichment facility using centrifuge technology here in New Mexico. Urenco USA, committed to safety, environment, and community through nuclear-powered electricity.
And by proud supporters of New Mexico PBS like you. Thank you.
New Mexico PBS presents the Congressional District 1 debate, moderated by Sam Donaldson.
Good evening. For the next hour, we'll have the kind of dialogue democracies such as ours depend upon. A comparison of viewpoints and policies this first congressional district debate is designed to inform. Now, this is an open seat in the U.S. House of Representatives. Representative Martin Heinrich is hoping to become Senator Heinrich, and as such can't keep his place in the House. Our candidates are Republican Janice Arnold-Jones. She's from Albuquerque and is a businesswoman and former state representative. Welcome, Ms. Arnold-Jones.
Thank you.
And our Democrat is Michelle Lujan Grisham. She also lives in Albuquerque and is a businesswoman. She's been a Bernalillo County Commissioner and a Cabinet Secretary for both the Department of Health and the Agency on Aging. Welcome, Ms. Grisham.
Thank you, Sam.
Well, we'll hone in on some key issues for the district tonight, but we're also likely to hear echoes in this debate of themes that sound across the national political landscape. Our rules: each candidate has 2 minutes for opening remarks and 3 minutes to close. As we ask questions, the candidates have 90 seconds to answer and another 30 seconds for rebuttal. If there's more to talk about after that, I'll loosen the rules. Our goal is an informative, engaging conversation. Before coming on air, we tossed a coin to determine the order of opening and closing statements. Ms. Grisham, you'll begin. 2 minutes.
Thank you, Sam. I'd like to thank KNME and Big Bird for hosting this debate, and Sam Donaldson, of course, for moderating. Now, starting today, New Mexico voters will decide who will stand up for them in Congress. I'm Michelle Lujan Grisham, and I've spent more than 3 decades standing up for New Mexico families. Now, I started standing up for seniors and veterans who were abused in nursing homes. I saw horrible abuse and neglect of seniors in many of the state's long-term care facilities, and I couldn't get a single state official with the authority to act to protect the residents. So I went undercover to expose this inexcusable neglect. My father dropped me off at a particularly bad facility, and I was admitted as a totally dependent stroke victim. I was subjected to neglect, humiliation, and I witnessed the despicable treatment of others. It was the longest 3 days of my life. I publicly exposed the conditions at that facility, and as a result, it closed. And then I led the effort to clean up other facilities and change state law. Today, New Mexico is the only state with undercover care evaluations. It's modeled after the work that we did. Now, I stood up because nobody would act. Today, Congress is failing its citizens because it fails to act. Too many New Mexicans are worried about keeping their jobs or even having one, and too many others are going without health care. And our children don't have the same educational opportunities that we once had. As your candidate for Congress, you deserve to know where I stand and what I'll do. I'll be a champion for the middle class. I'll fight to put New Mexicans back to work. And I'll protect a woman's right to make her own health care decisions. Now, I understand the financial and emotional burdens that New Mexico families face. As a widow and single mother, I understand and realize that women are often the last line of defense of the financial security for their families. When my father died, my mother couldn't afford her home, so now she lives with me, and in her failing health, I'm her sole caregiver. These struggles are real to my family, and I know they're real to yours. I know who I work for. I'll put you first, and I am ready to stand up for you in Congress.
Thank you, Ms. Grisham.
Thank you.
Ms. Arnold-Jones, 2 minutes.
Thank you. Good evening. I'm Janice Arnold-Jones. I am running for the U.S. House of Representatives in the 1st Congressional District, and I want your vote. In 1963, my father, an Air Force pilot, was killed on active duty. My mother gathered up my brother, my sister, and me and carved out a new life for us in New Mexico. I graduated from the old Albuquerque High School at Broadway and Central and the University of New Mexico. I am married to the love of my life, John Jones, a retired Navy commander, and I'm mom to 2 terrific young adults. I served 4 terms in the New Mexico House of Representatives, where I was assigned to the Tax and Revenue Committee. I spent 8 years working on legislation including taxes, election law, public policy, and protecting your money. This election is about clear differences. The difference between my practical experience as a small business owner and legislator and the experience of my opponent as a career bureaucrat. Now, my opponent is going to tell you tonight what I believe, but I want to tell you now what is true about what I believe. 1, I believe that jobs are the most important issue in New Mexico, and I believe that sustainable jobs are created by innovators in the private sector responding to market needs. 2, I will protect the very critical, very unique missions of our labs and our bases. And 3, I will protect Medicare and Social Security for our seniors. Now, healthcare is a very important issue, but without a healthy economy and a budget, healthcare is very difficult to come by. So tonight, I am going to talk about jobs. My opponent is going to talk about healthcare. I'm going to talk about the economy. My opponent will likely talk about healthcare. I'm going to talk about veterans, militaries, foreign policy, tax policy, energy, water, education, and my opponent will talk about healthcare. I hope tonight that you will listen very carefully because there is a very distinct difference.
Well, thank you, Ms. Arnold-Jones. We're going to talk about both of those subjects tonight, but let's begin with the jobs, because millions of Americans are without jobs, and I don't have to tell you, many of them live right here in the 1st District of New Mexico. And we'll get to that in a moment, should it be the role of the federal government to put forward programs, some of them which cost a lot of money, to speed up job creation, or should it be left mainly to private enterprise? Ms. Grisham.
I think there's an absolute role for the federal government in supporting policies that provide that very innovation and incentivize employers to provide jobs. Now, as a county commissioner, for example, I led the effort on infrastructure spending by starting the Paseo interchange. We brought Friedman Recycling here, a family-owned business that's engaged, of course, in recycling our waste. And we brought USC Bags and expanded their operations. Without those economic investment tools, those companies could not have expanded, nor would we have been able to invest in any infrastructure. These are hundreds of jobs on the ground immediately. The notion that the federal government should not be investing in infrastructure and closing corporate loopholes so that our jobs come back here and focusing and supporting Sandia Labs to be a more effective job creator for high energy jobs is tantamount to abdicating your responsibility to putting New Mexicans back to work as your single priority and making sure that there's investments in moving the economy forward. It is clearly a private-public partnership, and that's exactly what it will take to move this economy forward.
Ms. Arnold-Jones, same question, the role of the federal government.
Well, I think there clearly is a role for the federal government, but we have to be careful when we talk about investing in public-private partnerships. One of the infamous public-private partnerships is Solyndra, and it is very clear that that money would have been better spent. I believe that we need to focus on reducing and loosening up regulations so that businesses can flourish. And that's not to say that the infrastructure doesn't need to be there. I am a great fan of sewers, the internet, the things that make cities run, because that is also essential. But when we are tying businesses down with red tape, we are not thriving. And so things that we can do almost immediately is to pull back regulations so that our rules are attractive, sensible, and fairly enforced. And if you couple that with a reasonable tax policy that is predictable, broad, and fair, I believe that businesses will flourish. But the question is, what is the role of the federal government? The role of the federal government, in my opinion, is to create that infrastructure. And let me give you a good example of that kind of infrastructure. When I think about people coming to Albuquerque wanting to build on the west side, the real critical issues become roads, sewer, water. Those are really important roles for our government. Anything else belongs to the private sector.
A rebuttal?
Well, my opponent supports the Ryan budget plan. So this is as far away as you can be from any infrastructure investment. So you can't support government investments in infrastructure so that businesses can flourish and support the Ryan budget. They are mutually exclusive principles. The reality is, as a small businesswoman, you need access to working capital. We have to find the mechanisms to provide fair and equitable access to capital to these businesses as quickly as possible. My business, I couldn't have started a business if I couldn't have secured a loan. And today, banks have more money than in several decades, and we're not getting it out to the people who need it most.
The Ryan budget, it was really a tough budget when it came to cutting federal spending. What about it?
However, the Ryan budget is merely a proposal. As a legislator, throw me in that briar patch. I'm ready to get in there and discuss that. But there are other issues, and Michelle does bring up a good point about working capital, but here's where red tape just chokes our innovators. I met a young woman just the other day at a flea market. She has all the criteria. She's young, she's Native American. She is trying to start a new business. She has $12,000 into that business. And guess what? She can't even answer an RFP because of the cycle of insurance and workers' comp, and she can't even finish. So, is there a role? Yes, but it is the regulation that is choking us.
Okay, let's stay on jobs, and I said we'd come to the local area, and let's just stay with you, Ms. Arnold-Jones. Here's a statistic from August of last year to August of this year. New Mexico was the only state among our neighbors to not gain jobs. New Mexico lost jobs. Whose fault was that?
Oh. I believe that's Congress's fault. You know, we are still a federally dependent economy, and the impact of not having a budget, and as a former DOE contractor, let me tell you what that's like. Every time there is a continuing resolution, there is a holdback. After 12 continuing resolutions, there's not much there. And what that does to people who are federal contractors or DOD contractors is you may have a task order, but it's not funded. Pretty soon you have to tell your employees, gosh, I'll call you, can't pay your benefits. That is the impact, and I believe because our federal economy in this state is still so strong, that is why we're not growing. I can hardly wait to get to Congress to help diversify this economy.
Ms. Grisham, whose fault the loss of jobs here?
Oh, I think Congress is playing a role. I think, of course, issues here at the local level are also playing a role. I'm not seeing state government provide the investments that it really needs to spur the economy. But again, the Ryan budget passed the House 3 times. It's the budget that's moving into the Senate. It leaves no room for investing in New Mexico. Most states have 10% of their jobs are funded by the federal government. 25% are publicly funded jobs in New Mexico. The Ryan budget's going to cut that by 10%. It's an immediate loss to the state of 22,000 jobs. And worse, sequestration is already having an effect. So it's not for the regulatory environment in that regard or work orders. What's happening is that there's going to be a 10% cut across the board. I understand by folks in the business sector, we've lost about 2,500 jobs due to sequestration already thus far.
Ms. Arnold-Jones talks about continuing resolutions. She's quite right. Congress doesn't fund the government anymore. It simply keeps it going, and usually at a starvation pace in many areas. And that's because the parties can't get together. In fact, there's a feeling in Washington, I know you've heard about it, it's my way or the highway, and if it's not going to be my way, we just won't move. Surely this can't be helpful, can it?
No.
Why can't the two parties get together and make a deal like they always used to?
Well, you know what I think, Sam? I think that today we've lost the opportunity to have good, solid compromise. We've got an extreme wing, the Republican Party, the Tea Party, that has as their attitude basically no compromise, which is how you have the Ryan budget and how you now have sequestration. There has to be an opportunity for us to reach across the aisle, to compromise, to come up with strategic solutions that will really focus on meeting the needs of your constituents. Now, I was identified as a career bureaucrat. Well, the truth is I'd spent 17 years in state government. 2 parties, Republican governor, 2 Democratic governors, 17 years, because I successfully reached across the aisle and got things done that needed to be done for my constituents. And I did it again when I was a county commissioner. And again, the Paseo project was a project that the parties were arguing about. It just took some leadership by the Democratic Party. I did that without working against the Republicans in New Mexico, but working with them. So bipartisan, we now have a $93 million effort because I reached across the aisle. That's exactly the kind of work that needs to occur in Congress today.
Arnold-Jones, why can't the two parties at the national level come to some compromise agreement on issues that divide them?
Well, I actually think there is a structural problem. I actually believe that the structural issue is the schedule of Congress. If you go to work on Tuesday morning so you can get out and go home on Thursday at noon, there really isn't time to build relationships. And really good legislation requires good relationships, good discussion. You know, but I'm listening to my opponent talk about the extremism. You know, it comes on all sides. So we have a proposal in the House that did pass, but Harry Reid almost single-handedly shut it down, so the Senate never, ever even looked at the budget. And with all respect, but when you are in a Democratic legislature, which I was, but I was in the minority, it's very easy to get what you want done. When you're in the minority, however, it takes a lot of creativity. I have done that. And not only have I given up pieces of legislation because it was important to pass, but I understood that numbers count. So when you get to Congress, first off, we really do need to talk with one another, and that's probably the biggest message that I have, is that when I get to Congress, I will work to build those relationships. I will go to the leadership to change that calendar. I really believe that Congress needs to work Monday through Saturday, 3 weeks on, 2 weeks off, because we are not going to solve our nation's problems if we can't talk with one another.
Let's stay on this theme of working together. Because one of you is, I think, going to have to deal with the financial cliff we may go over at the end of this year. The Bush tax cuts expire at the end of this year, and on the 1st of next year, if the lame duck Congress doesn't do anything about it, the draconian cuts in defense and across the board in other services that were required to get us to raise the debt ceiling to pay our debts already incurred 2 years ago will take effect. So I think one of you is going to have to deal with that. Let's see how you would deal with it. Let's start with the Bush tax cuts. What should we do?
At this moment, I think we should try to sustain those tax cuts, because if we let them expire, not only will taxes go up on the rich, which is what everybody is hoping for, but it will go up on the middle class. And right now, we need to put everything we can into our private sector to be reinvigorating our economy. And without that capital, and for a middle-income family who makes $40,000 to $60,000 a year, that's another $2,000 out of your pocket that you weren't counting on. So my advocacy would be to make sure that we find another way to talk about it. Now, I have to go back to sequestration. You know, as a legislator, there is nothing that irritates me more than legislating and budgeting by across-the-board cuts. It doesn't work, and it means that Congress didn't do the job.
So you'd keep the Bush tax cuts for everyone?
I absolutely would.
All right. Bush tax cuts, Ms. Grisham.
Sam, I think that we need to let the Bush tax cuts expire for the wealthiest of Americans. They need to pay their fair share. There's no reason for us to be subsidizing millionaires. I think that the tax cuts for the middle class should stay, because they're in a position to least be able to afford it. You know, they're choosing between their cars and their houses and food and supporting their children. And this is no time to impact further the struggles of the middle class. But if we don't have those revenues coming in, then that's how you get to a draconian budget that's an austerity plan, the Ryan plan, which cuts 10% of the labs. You can't support Sandia Labs. You can't encourage the relationship between Kirtland and Sandia Labs when they're both going to get extreme cuts in both Ryan and in the sequestration efforts that are underway if we don't do something in Congress. We have to have revenue, and we have to be clear that the cuts that we would take in Congress would be thoughtful, not across the board, and would really focus on the ineffective spending in government, not on blanket social programs like Medicare and Medicaid.
Ms. Arnold-Jones, do we think we need some new revenue, or do you think, as many Republicans do and others, that we should not raise taxes in any way, the Grover Norquist position?
Well, I don't happen to agree with Grover Norquist on very many things, but right this minute, you know, I don't think we need to raise taxes. Is that across the board? Right now, what we need to do is to create an economy that is actually growing and thriving. And when you have a growing economy, more people make more money, they pay more taxes, we have more revenue. But it's not black or white. But I want to go back to the proposal that Paul Ryan has on the table. It is a proposal, and while we may not like it, I do not like the way that it treats our laboratories and our bases. In fact, I'm wondering where our delegation was when those discussions actually took place, because it's vital that, that we're actually there at the table. So what's your alternative?
Go ahead.
Absolutely. I mean, I think that's the real issue, is that the Ryan plan, again, is a budget that's been passed by the House 3 consecutive times. An effective plan for an effective budget would be a bit more balanced about making sure that you've got revenue coming in. So let's close the subsidies and loopholes for big oil. With $136 billion in profits, we don't need to be subsidizing oil and gas anymore. Let's make sure that the rich, the wealthiest of Americans are paying their fair share. And then we can focus on making sure that where we have to cut ineffective spending, or that we have more effective efforts. As an example, why don't we require in Medicare that we negotiate with pharmaceutical companies? These are ideas that bring revenue in, cut our costs, and protect these programs over the long haul. And I think the delegation worked hard to do something about the Ryan budget. But again, the Tea Party Republicans refused to compromise on any other budget, which is how you got the Ryan budget and how you got sequestration.
We'll come to Medicare next, as a matter of fact. But first, Ms. Arnold-Jones, what about the $4 billion of subsidy to the oil companies? President Obama says they're unnecessary.
Actually, I am going to challenge my opponent again. Show me in the tax code where that exists. As someone who has sat on the tax committee for 8 years, if there are subsidies, they are the same ones that go across all industries. And so I am looking for these fictitious subsidies that I cannot find. Now, if you're talking about...
You're saying the oil companies don't get a taxpayer subsidy?
They don't get a taxpayer subsidy. They take a deduction for their manufacturing expenses.
Right.
Every other business actually gets that same deduction.
Well, Sam, I have one for you. I mean, they get a depreciation allowance on oil in the ground. I'm pretty sure that no other corporation or manufacturing business is getting that deduction. They're depreciating and calling capital equipment oil in the ground. You know, the reason to subsidize these businesses is so that we want to have affordable and available energy and power in this country. But once they're successful and they are profitable, and they are, to the expense of any other investments, and today to the expense of having a much better balanced approach that puts New Mexicans and Americans back to work, that invests in infrastructure, this is no time to be subsidizing oil and gas.
I said we'd move to Medicare. Now, I think everyone I talk to agrees we cannot let these entitlement programs just go on as they are. They'd go broke, and people like me at my age, I don't know what we'd do. So when it comes to Medicare, as you know, the Ryan plan, which is now the Romney-Ryan plan, says by 2020, new elderly people who come to that age point will have a choice. They can stay in existing Medicare as it is today, or they can take the idea of a voucher and they use that voucher to buy private insurance. What's wrong with that?
We may not be here long enough for me to give you every issue about what's wrong with that.
Well, you have 90 seconds to begin with.
Because I spent my career advocating for seniors, and as a caregiver for my mom, I can tell you that she can't afford under today's Medicare program. Her co-pays and out-of-pocket costs. Most seniors today are underinsured in Medicare, which is why they buy a private Medigap plan if they can afford it. To ask seniors going forward and disabled adults to pay $6,400 more for their health care and to put them individually in a position to negotiate with insurance companies is tantamount to throwing them the wolves. If we could negotiate individually or unilaterally with insurance companies, then we wouldn't have to make the changes that we did in the Affordable Care Act. Medicare, we can do incredible savings. And I think the Affordable Care Act does an excellent job at taking $716 billion out of bonuses for insurance company CEOs and then putting it right into the benefits to close the donut hole. The more treatments we give for seniors and Medicare beneficiaries, the healthier they are. If we focus on disease management and solving chronic disease, we save Medicare for generations of Medicare recipients. But we don't do that. We're looking at ways to cut benefits for current and future beneficiaries. And I think this is absolutely the wrong way to go. And one last point. If you don't have everybody in a single Medicare program, you have no way to have everybody in that insurance plan, which brings costs down. So even though you're talking about future beneficiaries, believe me, those payroll taxes and those out-of-pocket costs for the current Medicare beneficiaries will go up.
Ms. Arnold-Jones, save Medicare for us.
Well, I would say first we've got to define some terms. You know, in the Affordable Care Act, we have some subsidies that are about akin to vouchers. The difference is who makes the decision, the government or the individual. My money is on the individual, because no matter what we do, when that $716 billion comes out of the Affordable Care Act, while I appreciate my opponent thinks that it's going to go into our pockets, what I see happening is those payments will be reduced to doctors and providers, and what we will have are longer and longer lines, less and less access. And so we can talk about affordable care, but there won't be any care, and that does not improve Medicare. So I think we go back to the drawing board. I like some of the pieces under the Ryan proposal that allows us to look at some other ways to do this. And so I still reject that we have to have an all or nothing proposal.
Rebuttal?
But I don't know what your proposals are. I mean, the reality is this, that the Affordable Care Act puts incredible investments into community health, which is primary care, and public health, which bolsters the delivery system. And today, without any changes, you bet it's difficult to have access. I navigate access for constituents all of the time. It's a very difficult issue. For the first time, we're investing in a workforce pipeline, and in alternative delivery systems. If we're going to increase reimbursement rates for doctors who take Medicare and Medicaid, we have to bring the cost of healthcare down. And for the first time in this country, insurance rates and insurance premiums, those rates have come way down, 4% over the last 2 years, and that's some of the lowest increases this country's ever seen. We're making the desired impact.
About the Affordable Care Act, Governor Romney for some time said he wanted to repeal it entirely. He would say on the stump, the first day I'm president, I will repeal it. And he was talking metaphorically in a sense, because presidents, of course, don't have that power to repeal laws. But now he says he would keep a portion of it. He would repeal most of it, but he'd keep a portion. What is your view on this act? Should it be totally repealed, partially repealed?
As a legislator, I would repeal the entire act, not because it's all awful, but because I think that what I call log roll legislation, where Americans cannot understand what's in the bill, is problematic. There are 3 pieces in the Affordable Care Act I absolutely would keep, and it would stand on their own, and that is the ability to keep our young adults on our insurance policy. My daughter's at law school. I'm happy that she is there. The pre-existing conditions. Thank you so much. You know, a long discussion that should have been dealt with years ago, and I think that should stay there. Also, being able to be more competitive, buying insurance across state lines is important, but what came with the Affordable Care Act is 159 brand new taxes and a lot of things in this bill that people are going to be stunned with.
Ms. Grisham, do you think Congress is going to repeal it? I know you would vote to keep it because
I
of your
would.
position.
I think that we have got to elect folks to Congress who are going to protect the Affordable Care Act, and of course I would do that. The notion that you could eliminate pre-existing conditions, keep your children on your insurance plans, and that those costs would be affordable to the average New Mexican is incorrect. I mean, the reality is our health care costs were rising so dramatically, and the percentage of our gross domestic product, that we know that as a country we can't sustain the healthcare system. People are losing their benefits because their small businesses and employers can't afford to provide that benefit because of those escalations. I am now having to buy insurance privately for myself and my daughter, and it's hundreds of dollars, and for some individuals it's nearing $1,000 for that individual. The only way that you bring those costs down is you have everybody insured, and the only way to provide healthy future reimbursements for our doctors is to make sure that they have access for every individual because they're covered.
So you would repeal the whole act, but then you would reinstitute some of the points that you talked about.
Those 3 pieces, but there are pieces that truly are problematic, not the least of which are all of the taxes that are new, that are going to surprise you. If you're a sole proprietor, you're going to be subject to 3.4% additional tax on top of your adjusted gross income. But that's not the least of it. The Independent Patient Advisory Board is truly problematic. They will be making decisions. They can enact new taxes and regulations, and quite frankly, there is no right of redress for the citizens. And at the end of the day, This debate is really about, do you really want the government to make your medical decisions, or do you want to make those decisions?
All right, a point in the act.
Oh, I'm sorry.
Yes, please.
Well,
go
I was
ahead.
going to say, I think that's a mischaracterization, and it's become, you know, the sound bite in these debates. Now, this group of professionals, hospitals use this today, doctors' practices use this. They look at what practices and procedures are giving you the outcomes for the patients that are desired, and looking at ways for us to be more efficient. And with the kind of technology that exists today in the medical field, no better time than making sure that we continue to lower cost and increase quality and access so that it is sustainable over the long haul. There is nothing in the Affordable Care Act or in this group that would allow anyone to come between you and your physician and the decisions that you make together about your health care.
Have the last word on this point for 30 seconds.
Absolutely.
And then we'll move on.
I have parents that are the same age of my opponents, and they've already been turned down for care. I have other friends who are trying to see a doctor. The earliest they can be seen is January. Really awful when you have a back issue. So what I see is, quality, price, service, those are things that have to be in balance. And no matter how I look at the Affordable Care Act, I don't see that we will be generating the money to give the service or to provide the quality something is going to give. And my guess is it will be access.
All right, let's talk about an issue that would occur if the act is repealed or changed dramatically, and that's contraceptive services for women. It's in the act at the moment, federal help for that, but if the act is repealed, something would have to be done if you think it's necessary and if you think it's proper to continue the services. Do you think it's necessary and proper?
Do you know, it's funny, there was a letter in the paper today about my funny comment about contraceptions for recreational sex. And I will tell you what, it was such a delightful letter because it didn't ever talk about that particular subject. But do I understand that this type of contraception can be prescribed medically for things like acne, cramps, and a number of other things? Absolutely, those should be covered. One could argue, should gentlemen who wish to be sexually active, just to be sexually active, should their Viagra be covered? Yeah, I don't know. But the question becomes, this is a religious question. And the question is should the Catholic Church and their hospitals be required to provide a type of medical care that they believe is against their beliefs?
Well, you know, the Obama administration changed its original policy regulation to say money would not come from the church, but their employees would be covered in some sense. But that's not good enough?
I don't think so. Okay.
What about this for women's contraception?
Oh, one of the most important aspects and benefits under the Affordable Care Act. I would do everything to prevent the repeal of the Affordable Care Act, again, primarily because of the protections for women's comprehensive health care. You know, preventing unwanted pregnancies is an economic issue. It's a personal issue for a woman and her family. And in New Mexico, where we have one of the highest teen pregnancy rates in the country, the notion that we would not be investing in access to birth control and family planning makes no social or health care policy at all. This is very effective public health policy. When I was the Secretary of Health, I worked diligently to make sure that we had age-appropriate comprehensive sex education, that we had access to birth control and family planning, and as long as we're on this topic, it's one of the reasons we can't pass any productive legislation, because you've got a defunding of Planned Parenthood and the removal of access to birth control in our transportation bill, in our Jobs Act bill, in the budget bills, and it doesn't belong. Government must protect a woman's right to make her decisions about her health care with her physician, in the same way that my opponent has identified that those relationships should be sacrosanct, that we want to make sure that we have access, that we don't want the government involved with getting between you and your doctor. But here it would be okay for the government to get in between you and your doctor, and I disagree.
Go ahead.
It really isn't about the government getting between me and my doctor. It's about who pays. And so birth control right now is $20 a month. If it isn't medically prescribed, why not be individually responsible? I think that's the issue.
You talked about religious concerns, and I think none of us at this podium tonight would in any way trample on anyone's religious beliefs. And I'm not asking anyone to do it, but there are a couple of things. Governor Romney supports a constitutional amendment stating that life begins at conception. And Congressman Ryan has co-sponsored legislation that says a fertilized egg has the same rights as a human being. Do you agree?
Well, I don't. You know, I take the stand that we should amend the Constitution with great care. And so would I, on the face of it, support that type of amendment? No, I would not. However, if you ask me personally, what do I believe?
What do you believe personally?
I believe that life begins at conception. That's what I believe.
Fair enough. Over to you.
Well, and I will answer the question, but Sam, again, we're having government involved in the wrong aspect here. Government has a role in preventing unwanted pregnancies. Government has a role in ensuring comprehensive health care. The debate about family planning and Planned Parenthood, where it's often the only access for primary care for women. These are investments that make sense, that save money, that save lives, and it's been litigated. We know exactly where we ought to be with Roe v. Wade, and these are all been underlying attempts to minimize those protections for women. I believe that these questions and answers are between a woman, her religion, and her physician.
All right, I think we've covered it. You've made your positions clear, and I thank you for that. Now, I think you've both agreed to that I will ask each of you a unique question, and it's not a rebuttal case, because it's not on an issue. It's about you, and I guess your beliefs, and I'll do that now, if I may. And this one's for you, Ms. Arnold-Jones. There's a widespread feeling that the Republican Party of New Mexico has not gotten behind you, as it should have, many people feel, and perhaps you feel, in raising money, in PAC money. And when it comes to endorsements, it's not even clear that Governor Martinez has come out swinging on your behalf. Do you feel the party has let you down?
I would like to tell you that I wish our party was as robust as the press coverage says it is. And it is not. Does it make me sad? Sure. And do I understand the political price of having stepped on a few toes here and there? Yes. I am an independent thinker, and so if you expect me to go along with, for example, Grover Norquist, that is not me. I am going to think about each bill. I'm going to think about absolutely every single New Mexican, and I'm going to make a determination based on what is best. Now, do I happen to believe in the Republican platform? I do, to the most part. It's politics. Does it make me sad? Yes, and Governor Martinez, come on down.
All right. I hope she's watching, and maybe you'll hear from her. Now, Ms. Grisham, a question for you. After you stepped down as Secretary of the New Mexico Department of Health in the Richardson administration, you formed a company that received a state contract from the Richardson administration, I believe to the extent of $650,000, to oversee the executive services for the state insurance pool. Now, while there's been no suggestion of wrongdoing, the question is there an appearance of favoritism here that could be troublesome to some voters?
You know, Sam, I don't think so at all, because first of all, we don't receive a state contract directly. We receive a contract from a private nonprofit entity that's established in law called the New Mexico Medical Insurance Pool, and it's done through a competitive bid process, which means to the viewers we have to compete to do that. I should also point out—
Were you the low bidder?
We were the best bidder and the most qualified bidder, and I can't tell you the rest because I don't recall. But we have been running one of the most successful high-risk pools in the country, so much so that, in fact, we also, through this same nonprofit entity, are responsible to run, in conjunction with the current administration, the federal high-risk pool. And I'm also proud to tell the viewers it is also one of the most successfully implemented federal high-risk pools in the country. And we have to compete, and we have to continue competing.
Thank you for your responses to those questions. Let's move along with the big issue, immigration. We could talk all night about it, but we don't have the time to do that. I think I know the answer to this question, but I formed the question this way, and it goes to you, Ms. Grisham, first. Do you agree with President Obama's June executive order that says children who were brought to the United States illegally, but who have met certain conditions, been here for 5 years, kept the law, obviously done good service, may remain in the country, and in fact can work and obtain driver's licenses?
Sam, thank you. I absolutely do. You know, when I was serving as the Secretary of Health, we were placing school-based health centers in many schools across the state. And as a result, I received information from the center about a 17-year-old Roswell High School student who turned 18, was turned in and was picked up at school. And that information was not provided to her parents. And for 3 days, the weekend and Monday, those parents had no idea where their daughter was. And she was being held for deportation. These are policies that break families apart. This young woman didn't make the decision to come to this country and was a very successful and hardworking high school student in Roswell. I think this is the kind of family-centered policy that begins to address the immigration problems in this country. We need a pathway to legalization. We need to make sure that those who are here doing nefarious or criminal activity that are prosecuted and provide restitution and then are asked to go back to their country of origin. And I think that we have to beef up border security and hold employers accountable for recruiting undocumented workers.
Ms. Arnold-Jones, what about that executive order in June?
Well, let me start with immigration. And clearly, we have an immigration policy that doesn't work for immigrants, it doesn't work for Americans, it's not working. So first and foremost, we need to secure our borders. But to have this discussion pushed where the only options are amnesty on one side or shipping 12 million people to some place that they don't belong in is not the answer in New Mexico. There must be a middle ground, and I believe that there is room for discussion. But getting to your question, which was this executive order, is exactly the problem that we have. I believe it is absolutely inappropriate for the executive to step on the purview of Congress. There should have been a discussion in Congress that builds consensus on this particular topic. And you know what? I actually think we need to raise the caps on immigration. We need the intellectual capital that is available in other parts of the world. We need it for our economy. I want to open those doors. But when an executive order is issued that literally carves out a piece of law, I believe it is inappropriate, and I believe that Congress needs to step up to the plate.
You think the executive order was inappropriate. I understand that. The viewers understand that. But the essence of what the order did, which was to keep young children in this country, do you think that was inappropriate?
I don't believe in visiting the sins of the parents on children.
That's in the Bible.
That's exactly true. And I don't. But I think there are a lot of other ways to do that without having stepped on this particular issue. And one of those things would be to create some additional programs. And I have offered several different suggestions about ways that we could approach it. It is not either or. And in our state, even the Braceros program, which is no longer effective, should be reinstated.
What about this? The president didn't have the authority, you think?
I think he was acting well within his administrative capacity.
But it was unwise to use it in this case, Ms. Arnold-Jones.
I think it's absolutely wise to use it, because if not, then the example that I gave viewers about that high school student, how many other examples are we willing, how many other risks are we willing to take? The issue is Congress won't act. They're failing to act, and what people are looking for and expecting, that their leaders are going to take action on the issues that matter. And the notion that we're going to dismantle our families and create this kind of harm is outrageous. And I think for the first time, we're beginning to move immigration policy forward. I think the DREAM Act has to get passed. I'm proud of the president for stepping forward and making sure that we don't harm these kids or these families.
Rebuttal of 30 seconds.
Absolutely. You know, at the end of the day, when the president decides to carve up an existing law and make an exception, I think it's wrong. I think he is stepping on the purview and the authority of Congress, and we may not like the way that Congress has acted, then I think the citizens need to send some new people to Congress, and quickly so. But where I believe that we have actually tread on the constitutional separation of powers, the executive versus the congressional versus the judiciary.
Okay, let's go to energy. Very big in New Mexico, very important to the state, and the issues that flow from that. And let's start with the idea of global warming. There's no question that we are warming. The question is, does human activity, carbon emissions, etc., contribute in any significant way to this event? What about it, Ms. Arnold-Jones?
You know, I look at lots of data, and I will tell you that my husband runs a water company, so we're always looking at the impact of the heat index and how much water are we using. And I look over time. I was just looking at a chart today about how much water was available and the heat index, and relating that to when I used to ride my horse across the Rio Grande. And in 1963, it was one of those hot periods. So when I look at that historical data, I can tell you that there may be an impact, but it is very unclear to what degree. Does that relieve us of the obligation of being good stewards of our land and our earth? No.
To what degree? But should we do something about the emission of carbons?
You know, I think we have done some.
Should the EPA be allowed to regulate as it is today?
No, the EPA is out of control. And I think that we actually have to pull that back. And that's not to say that we don't want clean air and clean water. They have done some very good things. But when we actually create things, and I will give you the example of fugitive dust and fugitive water, when we create such regulations that when a business complies with the fugitive dust rules and is now automatically out of compliance with the fugitive water rules, we're off track. And we've not addressed whatever the impact is of carbon.
Ms. Grisham, does human activity contribute, in your view, to global warming?
Absolutely. I'm clear about believing in the science and the data that we have that's clear and convincing, which is why the EPA is important, and this administration's effort for clean energy policies and new energy standards, including fuel efficiency, are so important. They provide us an above-all approach to a balanced power and energy design. It gives New Mexico real investments and opportunities. You know, right now New Mexico is fourth in its production of solar. We should be first in this district. Torrance County is burgeoning on the brink of really getting its wind power moving. These are exactly the kinds of things that are sustainable, and make sure that we have energy independence, which is a national security issue. Global warming is exactly the kind of thing that we ought to be paying attention to, so that as we make those future investments, they're making sense to a broad, balanced approach to providing clean energy to this country for future generations.
Your opponent is sure, but you're not.
The data that I'm seeing does not support my opponent's contention that it is as it is. I think it is open to question. But to say that solar and wind is reliable energy, it's not. I wish it was, but it's not. And so in that all of the above type of energy policy, which I happen to agree with, I think we have to look at affordable, accessible, reliable energy. It will make a difference in our economy. But as we go forward, are we sure we want to make our young mothers make the choice between whether or not they can get to work or heat their houses and whether or not they buy food? And that's our choice.
A quick question. I think we know your positions now. A quick question, if you will. The current regulations call for doubling vehicle fuel quality emissions, not emissions, but the standards, CAFE standards, by 2025. You for that?
Absolutely. Again, we have to move quickly to make the impacts, and I'm going to quickly in my 30 seconds. But I think that there may be modifications that make sure that vehicles are going to be affordable. You know, gas prices have been very volatile, so the one big benefit to New Mexicans is going to be, you know, those fuel economies and efficiencies would help you in the bank book. But you got to be able to access those vehicles. As a county commissioner, the state environmental agency, we're implementing a new state law that says we had to meet clean water standards through septic tanks by 2015, and it was a huge burden to water owners. So I brokered a deal between Democrats and Republicans that said we will inspect, we will protect our groundwater, and for folks who have leaking systems, we'll provide investments to help you afford that so that you can replace it. And if you've got a large area where that's the case, we'll invest in infrastructure. These are good policies that move you forward.
What about doubling the fuel efficiency standards of all vehicles by 2025?
You know, I think it's always a good goal to be more efficient. And one of the things we rarely talk about when we talk about energy is the role of conservation. I look at what our architects are doing in terms of the envelopes, the outer shells of buildings, and how we are actually going to make more advances, not using as much energy by conserving it. And that's an exciting part of the next part of where we're going with our energy policy.
All right, we're coming to the point where we're about to have closing statements. We've run out of time.
No.
I haven't gotten you to discuss how we curb Iran's appetite for a bomb or any foreign policy questions. Folks, blame me, not the two candidates. I'm sure they're prepared to answer those questions. But we have come to the end, and you each have 3 minutes in which to discuss anything you want. And because of the coin toss, Ms. Grisham, you go first.
Thank you. I want to thank Kane and me and Big Bird again. I want to thank you, Sam Donaldson, for moderating this important debate. And I really especially want to thank the viewers who have tuned in, because this is important, and we appreciate your participation as we discuss and debate these very important issues. Now, like many New Mexicans, my roots run deep in this community. And like most New Mexicans, I'm very proud of my heritage. Now, this is a heritage that's produced hard-working, family-oriented, proud people through 400 400 years of struggles and successes. And whether you've been here for 400 years or multiple generations, or like my mother, who chose to live here, we must focus on policies at the congressional level that focus on New Mexico families, that put New Mexicans back to work, that are very clear about the struggles in healthcare and day-to-day life that are really plaguing our families and creating a precarious environment right here in our community. My brother, for an example, when the recession first hit, 2007, 2008, he lost his small business. Today, I'm very proud of my brother. He's working 2 or 3 jobs. He's waits tables, he's a bartender, he manages restaurants, his wife is working. And if you ask my sister-in-law, she'll tell you that she's worried about how they're going to have enough money to send their son to college. These are the issues that people are facing today. And my opponent described me as a lifelong bureaucrat. What she failed to tell you is I was a public servant who brought integrity, credibility, and real results to my constituents, which is how I stayed through 3 administrations. That's what we're looking for in Congress today, is somebody who will take a stand, who will take a position, who will move those issues forward, not blindly follow the Ryan budget, but then talk about how you're going to protect seniors, you're going to protect veterans, you're going to make sure that we have a balanced approach, you're going to protect the labs, because this effort in Congress does exactly the opposite. It will turn Medicare into a voucher program, asking seniors to pay $6,400 more. It will change Medicaid into a block grant program, and those with disabilities will be hit hardest without having sufficient resources in the Medicaid program to provide the services that they need. This is a time when the federal government cannot abdicate its responsibility in moving the economy forward. It must take a clear and convincing position, a balanced and thoughtful approach to making sure that putting New Mexicans back to work is your #1 priority. And we're going to do that by making sure that the wealthiest of Americans, the rich, pay their fair share, that we're closing corporate loopholes, we're not going to subsidize big oil and gas, and we're going to get the Jobs Act passed, and we're going to invest in infrastructure. And we're going to make New Mexico the proud state, being the #1 producer for clean energy alternatives. Now, I'm that candidate who gets things done. I have a real record of success. I humbly ask for your vote. Michelle Lujan Grisham, I thank you for your time. I thank you for your support. Good evening.
Thank you, Ms. Grisham. 3 minutes, Ms. Arnold-Jones.
Thank you to KNME, Sam, to Michelle, and to everyone who is watching this evening. You know, this discussion and this election is so important. When I am in Congress, I want you to know that my priorities will be making sure that there are jobs, protecting our labs and our bases, protecting Medicare and Social Security for our seniors, and tackling the debt, also providing really good constituent services. But in order to create those jobs, we have got to pass a budget. We need to pull back regulations so that our business climate is attractive, sensible, and fair. We need to simplify our tax code, and we need to create and pull on our energy so that we are energy independent, energy secure, and that means jobs in New Mexico. Now, my opponent does say she has a record, and I agree, she does. As Secretary of Aging and Long-Term Care, she said nothing when individuals in nursing homes were charged $3,200 for a bed tax with no way to repay it. As Secretary of Health, on her watch, people died in nursing homes at Fort Bayard, and the immunization rate fell from 15 to 30 in less than 6 months because of the people, the experts that she either fired or drove off, and they were the ones who had improved the infant immunization rate. And she broke her promises to the voters when she stepped away from the county commission. She had only served less than half of her term before she decided to run for Congress, and in the meantime engaged in rolling quorums, that's backroom meetings, which is completely against the Open Meetings Act. That is exactly what I fought against in the New Mexico legislature. You know, this election is really about making some very clear choices. It is about the America that we all believe in, an America that provides opportunity, an America that looks to innovators and small businesses to create jobs, that creates and allows that when someone is down, we give them a hand up, that actually works together to build communities so that anyone can succeed. As a legislator, I have the experience and the integrity to make a difference for New Mexico. I'm asking for your vote. I ask you to send me to Congress. Thank you.
We're out of time, except I'm going to break the rules. Would you save Big Bird? You've twice suggested this. Would you save Big Bird? You remember you're at a PBS station.
I like Big Bird.
And you do too.
Love Big Bird.
All right. Thank you very much, Michelle Lujan Grisham and Janice Arnold-Jones, for a very, very vigorous but enlightening and civil debate. And thanks to everyone else for watching. The first absentee ballots in New Mexico were mailed out today, and early voting starts next week. We encourage you at home to talk about what you've seen tonight, and of course to make your voice heard and vote. Our democracy depends on it. Thank you and good night. Yes, indeed. We're still on.
New Mexico PBS Election 2012 coverage is presented in part by the American Cancer Society Cancer Action Network, through its Cancer Votes initiative, is educating the public and candidates about actions lawmakers can take to make fighting cancer a national priority. And by
Urenco USA, proud to support New Mexico PBS. Urenco operates the United States' first uranium enrichment facility using centrifuge technology here in New Mexico. Urenco USA, committed to safety, environment, and community through nuclear-powered electricity.
and by proud supporters of New Mexico PBS like you. Thank you.